Welcome back to Money School. I'm Mike Frost here at Mach 1. In Money School are things you've always wanted to know about money, just didn't know who or where to ask. And we're in session number 10. Can you believe it? Session number 10. Here's a list of all the ones that we already have recorded. If you are interested in any of those, we highly recommend you go back and watch these, especially the first three. Those are the foundation of a good financial plan. So if you haven't watched those, highly encourage you to go back and watch those. Get you a pencil and paper out too. You might want to take some notes. All right, so today you come here and you want to hear more about Medicare and Medicaid. A lot of people interchange those and they are totally separate. And we'll do our best to take a subject like this and make it interesting and something you might remember. All right, let's go. Medicaid and Medicare, the history. All right, so here's some history. We got to know how this thing all came about. It happened in July 30th, 1965. President Lyndon B. Johnson signed into law the Medicare and Medicaid. The original Medicare program included hospital insurance and Part B medical insurance. But today we've got four pieces. It started out with two, okay? We all pay into this, okay, 1.45% of earnings into FICA, Federal Insurance Contributions Act. That goes to Medicare. Your employer also pays that. If you're self-employed, you get to pay them both. You're lucky on that point. Now that's Medicare. Care, think of care like your health care. Medicaid is a federal state program. It varies from state to state. You got to qualify state to state, but it has federal guidelines. Medicare is totally federal, absolutely 100% federal program. Medicaid, state program, federal guidelines. Big difference. Medicare, insurance program. When you turn 65, that's what you're going to go on with some minor exceptions. So most people look forward to at 65, they get on Medicare. Medicare is not free, and we'll go over some of that. Medicaid, significance on aid, is an assistance program, mainly serves low-income folks. And that could be their health care, it could be children with their health care, it could be long-term care. But it is folks with low income or no income, okay? Medicare, here we go. We're strict on Medicare now. Everybody at age 65 has to sign up. Doesn't mean you have to take it at 65, but when you turn 65, 3 months before, the month you turn 65 and 3 months after, 7-month window, you have to sign up. Now, if you're working for an employer that offers a program, you may be exempt from that, but you still got to tell them that you're signing up. If you don't, you will pay a penalty when you do sign up, and that penalty will last the rest of your life. Don't do that. Age 65, sign up for Medicare, okay? Now, Medicare has four parts. Let's get these down pat. First part, hospitalization. If you've worked at least 10 years, you get it free. Boom, get it. If you work for an employer and you still have medical insurance at age 65, go ahead and take Part A. It's free, why not? Okay. Part B, this is the piece everybody pays for. $148.50 per month. Normally comes out of your Social Security if you've already started taking Social Security. But Part B covers the doctors, outpatients, hospitals, things like that. Hospital equipment, okay? So that's Part B. Part B is the one you pay for. You will always pay for Part B. Part C is known as Medicare Advantage. Now this is actually where Medicare, the federal program, says, okay, we're going to hire some independent third-party insurance company to administer the program, and we're going to pay them. And you sign up for Medicare Advantage through Blue Cross, Blue Shield, United Healthcare, whomever, and you pay that $148.50 to them, and they take care of all of your medical expenses. Now, you got to read the fine detail, but that's in a nutshell what it is. So Part B is like a comprehensive program. You're not in, quote, Medicare, you're in Medicare Advantage. Big difference. If you're about ready to choose which one of these you want to do, there's some upsides to both of them. There's also downsides, so you have to know what you're picking. Again, when you first sign up for it, if you do one of them, it prevents you from going back and do something else. So know all the ins and outs before you choose this. Part A, hospitalization. Part B, hospital, you pay a $148.50 for. Part C is a comprehensive program. Part D then would be your prescription drugs. So normally how this works, most people have Part A, B, and D. That's traditional Medicare. If you choose Part C, that's Medicare Advantage. A, B, D, Part C. Okay? All right. And then a lot of people pick this thing called Medigap. If you do traditional A, B, and C, then you probably want a Medigap policy to cover the deductibles. And that could be just as much as what you pay for Part B. Currently, $148.50. All right. Now, I say $148.50, but what if you make a lot of money? What if you get you sell a piece of property and you make a huge windfall? Well, you know what? It will affect your Medicare payments. What? I make a lot of money and my Medicare goes up? Yeah, it goes up for 2 years, no less. So here's an example. So right now, if you married filing jointly, you make less than $176,000. Your Medicare Part B is $148.50 a month. Pretty simple. Okay, let's say you sell a piece of property and then you make $100,000 off of it. Now your income instead of $176 goes to $276. Well, that just bumped your Medicare Part B premium from $148.50 to $297. Double, just because you made a little extra money, and it's for 2 years, even though it only happened for once, and next year your income goes right back down. So that's why you got to seek a professional when you're doing this to make sure when you do something over here, it doesn't affect something over here. That would include Roth conversions, can mess this up. So know what you're doing before you do it, because once you've done some of those things, you can't go undo it. All right. For most people, though, $148.50 per month for Part B. Medicare Advantage. All right. What is this all-encompassing Part C Medicare Advantage? All right. Basically, it says the Medicare program is going to pay a third-party company, and they're going to administer all your health care. They're going to be 100% responsible for it. Now think about it for a second. $148.50 you're going to pay in. Medicare is going to pay this insurance company X amount of dollars. Says, okay, now you take care of Mike Frost, all his insurance. Well, it behooves that insurance company to do it in the most efficient way possible, and they do. They do a very good job of it. If your doctors, your prescriptions all fit inside of a Medicare Advantage program, it may be a great option for you. However, if you choose Medicare Advantage when you first become eligible, and then you want to go back to traditional Medicare, insurance companies do not have to take you for a supplement. Said another way, when you first sign up for Medicare, every insurance company has to provide you a supplement program with no underwriting. But if you refuse that and go to Medicare Advantage and then want to come back, then you got to pass medical underwriting to get a supplement program. So you got to know all those little things before you make a decision. All right, so how do you sign up for Medicare? Well, here's a website, medicare.gov. You go in, you sign up. Here's an example of a program on Medicare Advantage. Now notice here, 0 cost per month. You're going to pay the $148.50, right? That's just given. But 0 extra per month, 0 deductible on drugs. But then you notice there on the right-hand side, it says a total of $5,800 out of pocket per year max. So you need to be ready to pay that, because you'll pay that, and once you've paid all of that, you don't pay any more. Now these programs change every year, so this is just an example, okay? But this is in Medicare Advantage. And if your doctor's in there, if your prescriptions are included, it may be a good option for you. But you also should ask, do you like to travel? If you like to travel, your Medicare Advantage may not cover you if you go overseas. So you got to know all that too, but then you can buy a policy to cover you. All right, that's Medicare, that's health care. Let's talk about Medicaid. Again, Medicaid is a state-run program with federal guidelines. Okay, so what does it take to be a Medicaid eligible in the state of Arkansas? Well, you got to be a U.S. citizen, legal alien, or a permanent resident. You got to have low income, and we'll cover what that means. And you have to be a resident of Arkansas. You can't be a resident of another state and apply for Medicaid in Arkansas. These are state programs. Each state has their own. If you are eligible for Medicaid in Arkansas and you relocate to Georgia, then you have to reapply in Georgia. All right. So what are the income limits, Mike? Okay, you told me this. So if you have a family of 3, if you make less than $29,207, you qualify for Medicaid. That means they'll take care of all your health care, all of those things. $29,207 for a household of 3. If you're single, if you make less than $17,000, you're eligible for Medicaid, all your health care. Okay? So here are some interesting statistics on the state of Arkansas. 1 of every 2 children in the state of Arkansas qualify for Medicaid. 50% of the children in Arkansas qualify for Medicaid. That was shocking to me. 2 out of every 3 nursing home residents, long-term care, are Medicaid residents. 2 out of every 3, 66%. Those were shocking statistics for me. So if you wonder where your Medicaid money is going, there's your couple examples. There's a few more there, but those are the 2 that I wanted to point out to you. All right. So what if you need nursing home care and you don't have much assets? All right. You will get nursing home care. You've been paying into Medicaid, so it's not free. You've paid in for it, so don't feel bad about taking it. But to get Medicaid and go to a nursing home, you can't just walk up to a nursing home and say, hey, I want to come in, I want to be a resident. Can't do that. Has to be prescribed by a doctor. Okay? Now, the most money you can make and Medicaid pay for it is $2,382 a month. Now, if you're married, that doesn't count the spouses. This is just for you. Okay? That's the income amount you can keep, that you can earn. Okay? Now, here's the things that you can exempt. Now, these are a little shocking to me. You can keep a home valued at up to $600,000 and Medicaid will still pay for your nursing home care. That's interesting. You can keep $3,000 in the bank. You can keep a car. You can keep any burial plot you've already paid for and any prepaid burial plans, funeral home plans. Okay? Now, if you're married, your spouse gets to keep $130,000 and they get to keep $2,382 a month of income as well. So this is where we call the spin down rule. If you've got a large, let's say you have $500,000 of assets and you want Medicaid to pay for your long-term care, well, that $500,000 of retirement assets have to be spent down to $130,000 before Medicaid to pay for your long-term care. Something to keep in mind. There's this thing called a 5-year look-back rule. Some people say, well, I'll just give all my stuff to my kids. Well, if you've done that, within 5 years of requesting Medicaid, they can go and undo that, or they can say that was worth 2 years worth of nursing home care. We're not going to pay for your first 2 years of care. So don't think about you can just go give stuff away, put it in somebody's name, because if you do that and you go in the nursing home within 5 years, they can go and undo all of that. If income or assets exceed any of these amounts, you may still be able to qualify by creating something called an income trust. Now, we're not attorneys, but if you look up Medicaid eligibility, it'll tell you to do this. Basically says do this. Put all your assets inside of the specific type of trust. Have that trust open at least 5 years, and it's irrevocable, meaning you cannot change it. If you do that, and it's been 5 years, and now it's time for you to go in the nursing home, Medicaid will most likely cover you. You should seek the advice of an elder care attorney about this. Again, the 5-year rule is key. All right, summary. Medicare, your hospital care, medical care, Medicaid for low income. Okay, that's the 2 you got to remember. Medicare. Healthcare for those of us 65 or older. I'm not quite there yet. I'm going to be there for long. You got to sign up for it. If you don't, you get charged a penalty when you do. So you got a 7-month window. 3 months before, the month of, and 3 months after your 65th birthday. Even if your employer is still paying for it, sign up, take Part A. It's free. Then you have to make a choice. When you're on full-blown Medicare, traditional Medicare, Medicare Advantage, seek the help of a professional before you make the determination. Okay? Neither of them is free. They're both going to cost you at least $148.50 a month. That's Part B, minimum. Okay? And most people don't realize this, but Medicare, traditional Medicare, does not include dental, vision, hearing, any of that. Some Medicare Advantage programs do, but you can buy supplement programs to cover that, so that's not a big deal. Okay? A lot for you to consider before you sign up. You really need to do your homework. These are one of those things, when you sign up, you're signed up. And you can't undo it until the next year, and then you may have some parameters you can't undo. So be sure you know what you're doing before you sign up. Medicaid, state-run, federal guidelines, okay? It's really meant for low-income residents of the state, okay? It does have nursing home care coverage, but it has spend-down rules. If you got a large amount of assets, you're going to spend those down before Medicaid will cover, unless you do something like what we mentioned, the specific type of trust. An elder care attorney can advise you on that, okay? Again, lots of information to think about. And planning is the key. Don't think you're going to walk up the day before you go into nursing home and say, well, okay, what do I need to do? Too late. That 5-year rule will catch you. All right, here's what we like to end with. Thought of the day. Good fortune is what happens when opportunity meets with planning. Good fortune is what happens when opportunity meets with good planning. Medicare, Medicaid, Social Security all require good planning. Come see someone like us, a fiduciary. We'll help guide you in the right direction, and we'll refer you to people that we trust that can help you with all of these. All right. If you like this video, give us a comment, give us a thumbs up. Send questions, comments, either here on Facebook or on YouTube. If you want to contact us at our website, do that, or call us, 479-876-2100. We'll be happy to help you. This was class number 10. We have one class left, and I'll tell you, to me, it is the most important. See you next week.